Adolescence, a time of endless possibilities, filled with joy, happiness and energy, when everything is imaginable and seems achievable. 20% of India's population constitutes boys and girls aged 10 to 19. Many behaviors in adolescence can have a major impact on later health. The WHO estimates nearly 60% of premature adult deaths are a result of conditions originating in adolescence. Improving adolescent health and nutrition and delaying early marriage and first pregnancies are crucial in breaking the intergenerational cycle of undernutrition and poor health. Ekjut, whose mission centers around improving maternal, newborn, child health and nutrition of underserved and marginalized communities in India, has now launched JIAH, the Jharkhand Initiative for Adolescent Health.
और इसमें हम बच्चों के साथ में काम करते हैं, जिसमें 10 से 19 साल के बच्चों के साथ में ज़्यादातर काम होता है हमारा। और इसमें हम 4 मुद्दों को लेके काम करते हैं, जिसमें है स्वास्थ्य, पोषण और बच्चों के पढ़ाई लिखाई को लेके, और साथ में हिंसा के ऊपर भी काम करेंगे। ये हम पार्टिसिपेटरी लर्निंग एंड एक्शन, जिसको हम PLA शॉर्ट में बोलते हैं, तो इसी के द्वारा हम उन तक पहुंचना चाहते हैं। और इसके साथ साथ जुड़ा हुआ है कुछ लीडरशिप एक्टिविटीज़, जो नेतृत्व के साथ में जुड़े हुए कुछ कार्य भी हम करते हैं, और आजीविका के साथ में भी कुछ काम करते हैं, जो बच्चों के साथ में उनके ही माहौल में हम कैसे सुधार ला सकें, इसके बारे में चर्चा करते हैं।
In all its intervention programs on maternal, newborn and child survival, undernutrition and gender-based violence, Ekjut has successfully used a unique capacity-building approach called the PLA, Participatory Learning and Action. This approach helped to reduce neonatal mortality rate by 45% in the 3rd year of the intervention. Ekjut is scaling up PLA through the Government Rural Health Workers Program, or the ASHA program, in several states of India. RKSK, or Rashtriya Kishore Swasthya Karyakram, is the Government of India's main adolescent health program.
We could also align with the RKSK, what their strategies are, what are the issues they are focusing. So that was in our mind, so that we can scale it up.
Of the many challenges faced by Jharkhand's adolescent population, undernutrition, dropping out of school, violence, early marriage and early childbearing, and mental health issues are alarming. JIAH aims to improve the health, nutrition and well-being outcomes among 40,000 adolescents of Kundpani block of West Singhbum district of Jharkhand, who are predominantly Ho tribal, through participatory learning and action. Before the intervention began, a detailed literature review of global and local evidence was completed. This was followed by baseline surveys of 3,324 adolescent girls, qualitative data collection through 13 focus group discussions and 15 semi-structured interviews with stakeholders, including adolescents, were also done.
The quantitative survey showed that around 45% of girls were found to be stunted. On the other hand, qualitative data collected through focus group discussions, semi-structured interviews with parents, teachers, frontline health workers, and adolescents revealed that there was lack of access to health facilities, exposure to violence at home and school, limited livelihood opportunities, trafficking, and that girls face sexual harassment, early marriage, and childbearing, and they also lacked parental and financial support for secondary education.
32 mapping exercises were conducted with over 1,000 adolescents, and 2 workshops were held with adolescents and various district level and state level stakeholders to create an effective intervention. To lead the intervention, 30 local youth facilitators or YUVA SAATHIs have been recruited, trained, and undergo periodic capacity building. They steer the cycle of group meetings every month with adolescents in their communities and support them individually as well. BAGUN, who supplements his income making leaf plates, is a YUVA SAATHI. He works with the adolescents, the village elders and guardians in his village as an agent for change.
10 से 19 साल के किशोरों और किशोरियों के साथ काम करता हूं, जो स्वास्थ्य, शिक्षा, हिंसा और पोषण के बारे में हर महीने में एक बार मीटिंग करते हैं.
After getting the adolescents to mutually agree on a convenient date for the monthly meetings, YUVA SAATHIs go door to door, reminding the adolescents and their parents to attend one day prior to the meeting.
जयंती मीटिंग टाइम जगह भी है गपा दो मीटिंग में ना हो 8 बजे स्कूल तो कम से ना तो कम से ना
Games, dance, music, and stories are a fun and crucial way of engaging with adolescents. They discuss, plan, and implement local doable strategies amongst themselves to bring about changes.
एक बार हम लोग गया कि ये मीटिंग है कि क्या है, हम लोग कभी नहीं जाएंगे इस मीटिंग में, ऐसे सोचते हैं. नहीं, एक लड़की बोला कि हम लोग मीटिंग में जाएंगे, बहुत कुछ सीखने को मिलता है, बहुत कुछ देखने को मिलता है, बहुत कुछ खेलने को भी मिलता है, ऐसे बोला. तो हम लोग गए कि बहुत कुछ उसमें से लाभ मिला है हमको.
शिक्षा विभिन्न प्रकार से मिले, खेल के माध्यम से, नाटक के माध्यम से और अनेक प्रकार से हम लोग को शिक्षा मिल रही है. इसलिए हमको वहाँ मीटिंग में आना अच्छा लगता है. मीटिंग.
This mother of 4 is a regular attendee at the monthly meetings, as is her daughter.
Ya, anya meeting tak sentane tege, sabin eto etana ando sum jau tene. Ene tege anya hono school ko ka ye bagiya. Ardo ka seno te na mana meeting ta sentane te baring eseno school ko.
Different local stakeholders like village leaders, teachers, and health workers are also involved in JIAH to ensure its impact and sustainability.
Abu ini nak ke hujur tu ko saben abu inta itu abu sia gian marsal bu namiam te aku ajagar kau melke इनके सब ते ने कहाँ से तो अबू नहीं था वो हुजूतन की है.
व्यवहारिक ज्ञान देते हुए जो छोटी छोटी बातें हैं, उन छोटी छोटी बातों को ध्यान में लाकर एकजुट संस्था जो है उनको बताती है, जागरूक करती है, और इससे यहाँ के हमारे विद्यालय के बच्चे बच्चियों को काफ़ी फ़ायदा हुआ है.
Working with the local Anganwadi Sevika, ASHAs, and auxiliary nurse midwives are key to improving adolescent health concerns like anemia.
किशोर किशोरी के तो अब कम उम्र में जल्दी भटक जाते हैं, नशा का अधीन हो जाते हैं, घूमते हैं. तो यहाँ पर बैठक में आएंगे तो लोग कुछ अच्छा जानकारी मिलता है, ऐसा ठीक नहीं है. As part of the education-related strategies, Tulsi, along with others, are being encouraged to rejoin school.
तुलसी सुंडी 9th क्लास में स्कूल छोड़ी थी, तो उसके लिए टीचरों से बात करना है कि उसको 9th क्लास में दोबारा दाखिला होगा कि नहीं.
11 years old, Pungi had to discontinue school to shoulder the responsibility of household chores after her father sustained a leg injury. Guidance and support from her teacher gave her the strength to rejoin school. Girls in particular face restricted mobility, harassment, and are exposed often to violence, and many such issues get discussed under the theme of violence.
मैं स्कूल जाना डरती हूँ। बहुत कोई लोगों का मुंह से सुने हैं कि किसी लोगों का लड़कियों को बर्बाद किया जा रहा है, रास्ता में अकेले पाया जा रहा है, कि ताकि मेरे साथ भी ऐसे तो क्यों ऐसे नहीं होगा, इसीलिए मुझे डर लगता है।
At the request of adolescents and their families, livelihood activities like organic farming, multi-cropping, SRI or system rice intensification techniques and nutrition gardens are included.
पहले उसमें 1 क्विंटल होता था, अभी 3 क्विंटल हो गया है मेरा, बहुत खुश हो गया।
Using the SRI technique helped save time, increased productivity and tripled the income for Suresh, making him a role model for other farmers. Seeing the yield, his wife is planning for the future.
तो उस पैसे से मतलब 3000 पैसे से बकरी खरीदे पालने के लिए, मुर्गी खरीदे और बच्चे को मतलब कि अच्छा से पढ़ाई करवाएंगे।
For Jai Singh, the multi-cropping technical inputs prove to be extremely rewarding. His small farm is yielding a variety of vegetables and he is already planning to expand it.
It was important that we make it more interesting by adding other interventions such as programs on leadership, adventure and sports, so that we are able to retain their interests.
Sports like football are used to develop leadership. It builds confidence, resilience, teamwork abilities, problem-solving skills, and friendship with peers. Adolescents also get an opportunity to participate in national and international events. Trekking encourages adolescents about protecting and sustaining the environment and gives them a deeper understanding and knowledge.
अच्छा नैना दो चिकन दारू तना तिरिल दारू को मैंने
ये जैसे आज ट्रैकिंग हुआ, ठीक है, कैसा लग रहा है अभी? और भी आगे जब करेंगे आप लोग आओगे कि नहीं आओगे?
Street plays by adolescents that cover issues of early marriage, gender equality, and substance abuse are now being featured during festivals. Cycling lessons are also given to enhance mobility. Participatory learning and action for adolescents and by adolescents is a multifaceted and a holistic approach for addressing their needs and priorities in a respectful way. Jharkhand Initiative for Adolescent Health is hoping to achieve just that.